Anxiety and stress can cause palpitations. Often these palpitations are benign in nature. It can just be that the patient is noticing their heartbeat more than they would normally do. And on occasion, the palpitations can be more significant than the normal heartbeat. They may be an abnormal heart rhythm, which is brought on by stress and anxiety. This, however, is rarer, but you should seek medical advice if you are concerned. So there are a number of different causes for palpitations. Some, as discussed, could be related to anxiety, but additionally, it could be related to a problem with the heart wiring. This can cause palpitations to occur, and this can occur sometimes at rest, sometimes with exertion, and sometimes due to stimulants such as caffeine and alcohol. Additionally, there are some lifestyle factors which can make you more prone to palpitations. As discussed, it could be stress, but also being overweight and having a problem with your sleep. All of these things can also influence palpitations at that time and also during the day. So palpitations is an abnormal perception of the heartbeat. Sometimes palpitations can just be a perception of the normal heart beating faster than normal. This can occur if you've gone for a quick walk, a brisk walk or exercise. You can notice that, and that's a very normal phenomenon. Sometimes the palpitations can occur if there is a problem, as I mentioned, with the wiring and there's an abnormal electrical connection in the heart. Here, the abnormal wiring causes the rhythm to change into an abnormal rhythm, and it's that abnormal rhythm that the patient feels as the heartbeat being different to normal. At that time, the heart rhythm changes, and this can be faster than normal. It can be slower than normal. There can sometimes be some extra beats thrown in, and after the extra beats, there can sometimes be a pause in the heart. All of these may be perceived by the patient in different ways. The heart can be faster, it can beat slower. Sometimes the patient can feel lightheaded and even dizzy, and on rare occasions, the patient may even collapse. If the palpitations occur with stress, it may be that it is just a stress response and the heart is beating faster than normal, but not in an abnormal rhythm. This, of course, can be worrying and troublesome, but may not necessarily be particularly clinically significant. However, if you get palpitations and you feel dizzy or lightheaded, or if you get palpitations with exercise and exertion, this could be a sign that there is a problem with the electrical wiring in the heart, and the palpitation may be a sign of an abnormal heart rhythm. That is the time that you should seek medical advice. So that depends on why you're getting the palpitations. If it is due to a stressful situation, try to keep calm, try to remove yourself from the stressful situation. Sometimes having a drink of water can help settle the nerves as well. If the palpitations are due to an abnormal heart rhythm, the same rules apply. Try to keep calm, try to take some deep breaths in. If you are diagnosed with an abnormal heart rhythm, such as SVT or supraventricular tachycardia, sometimes blowing into a paper bag, sometimes rubbing the side of the neck can help ease the palpitations. These pieces of advice would only be given after the diagnosis has been made by a medical professional. The doctor looks at the whole picture when it comes to the palpitations. If the palpitations are due to stress, the doctor will work with the patient to try and decrease the stress. And this can also include things like yoga, relaxation, and cognitive behavioral therapy to decrease stress levels and decrease the palpitations. If the palpitations are due to a hormonal problem, such as a malfunctioning thyroid gland, medication is given to control this. Normally, if the palpitations result from an abnormal heart rhythm, the first treatment option is medication to suppress the palpitations. Sometimes, if the medications do not work, there are more invasive options, such as removing the abnormal wiring in the heart. This is a procedure called an ablation, which is usually straightforward. Local anesthetic is given in the leg. A tube is passed up into the heart under local anesthetic, and the abnormal electrical wiring or tissue is burnt away, full stop. The abnormal electrical wiring or tissue is burnt away. The patient normally does not notice this as local anesthesia and sedation is given, and of course this can be performed under general anesthesia if required. Usually this results in a cure of the abnormal heart rhythm.